Good afternoon. This is the Board of Health monthly meeting, and today is Thursday, February 2nd, and the exact time is 4:30, and we are in session, and I would like to turn over to Dr. Brophy, the chairperson of the Board of Health, but I'd like to acknowledge the attendees today. Presently is Dr. Brophy, Mr. Fisk. We have also the assistance of Mr. Michael Simmons from the BCA TV. We have Louis Itasi, that is a nursing student at UMass, joining us for observation, and we will be joined at some point by Andrea Terry as well. Myself, the executive director of the Board of Health. I am not sure yet if Dr. Andrade will be joining us, but for now, we are in attendance, and I will pass over to Dr. Brophy.
Right, so thank you, Dr. Mansour. So let's call the meeting of the Board of Health for February 2nd to order. First item on the agenda is the approval of the minutes from our December meeting. Mr. Fisk, any edits or problems with the changes?
No, I don't see any.
Okay, so could I have a motion to approve?
Yeah, second.
Okay, all in favor? Aye.
Aye.
Okay, next item on the agenda, moving forward with the life science bio-ready community plans and adoption of the NCI guidelines for recombinant DNA. So I believe we're in discussions right now with multiple, or have contact information to discuss with multiple municipalities right now. We've met with several folks to give us guidance, and I think in moving forward, the plans now are to draw up the requirements for the Board of Health and the various committees that need to be in place and the infrastructure that will be adopting here in Brockton, make sure resources are available for that. And I think once that's in place, Mr. Fix, we can, then bring it to the board with a motion with that document to move it forward.
Yes.
Do you have any other comments? I mean, you've been on a couple of the calls that we've had with the experts, and I think we've had a chance to raise all of our questions and have gotten a lot of guidance on how this has been done in other municipalities. And, I think, that I didn't, at least from my end, and you can comment, I haven't seen anything that would be an issue as long as we create the appropriate guidelines for allowing the companies that are developing recombinant DNA, assuring that they're following the guidelines, and then the appropriate oversight that the board will have in place. So, and the support to do that. But I think with that, it'd be a great advantage to the city to be able to make this happen. So, any questions on your part or comments?
No questions here.
Yep. Okay, great. So I don't think there's any action item except for, at the board level here for the contact to be made with those and for us to put together the board members, the department here to get together the plans for what the board will require. And then we can bring it to the board and talk to Mr. May again about what is required and as for the board's requirement for the city to move forward with it. Dr. Montessor, anything else to add or?
No, that's it for now. So I will continue to see how best I can engage the municipalities. And as soon as I do that, probably at your pleasure, we would move to see whether you want to have a Zoom meeting with them or a phone conversation or in person. I don't know.
Yeah.
That will be at your discretion.
Yes, but I believe my understanding is once all documents are placed, it will have to formally come to the board for approval. So at some point, Mr. Fisk, we're going to have to, we'll have to have a final document in place and approval made by the Board of Health. So, but the process is moving.
And I'd like to make sure Dr. Whenever the meeting is, make sure Dr. Andre's here. I'd like his input in it.
Absolutely, yes, absolutely. I totally agree with that. So next item on the agenda is, previously the board had voted to deny a request for new tobacco licenses in the city. And I believe there is someone who would like a license that has requested some documents about the denial and other licenses that have been permitted within the city. So any updates? I think we've supplied all the information that has been requested, or
Yes.
maybe you can update us.
Yes, I have issued all the documents that the law firm representing that business that we denied a while back, a few months ago. And so apparently the person reached out to the law department, meaning the attorney representing the firm. So they reached out to the law department of the city, and I was notified that the owner of the property would like to speak with the mayor. So that's the last I've heard. I don't know exactly if any direct request has been made to the mayor by the person, but the law department did inform me that the person would like to do that. And so I just wanted to update the board on this. So
Okay.
that's the latest I've had.
But as far as you know, no other documents or anything that on your on behalf of the board that are that we need at this point.
Not that I'm aware of.
Okay, great. Right. Any questions?
Just a correction, in other words, actually, there are two specific pieces of information that are not found. One is with for the Cumberland Farm, the one at the 1205 Belmont, because somehow the process has already started before the pandemic, or before the we took the official order to put a cap on tobacco licenses, and so therefore that went forward. But so we went forward with it, and I think there is a misunderstanding as to which one. So that's the one that the person did ask, but actually I think that there is another one that that we the board did approve because the request has already been placed, and also the other one that we couldn't find all the paperwork that were submitted to the Board of Health for the gas station Divine. Irvin, pardon me. And so those are the documents that we could not find, but we have the permit of the license. So I was able to also dig into the past minutes between 2019 and 2021. There were a few excerpts that I could put together with respect to the agenda in minutes, but did not elaborate as to including what was submitted by the requester. So we had a little bit of limited amount of information with respect to those two stores.
I see. So they asked for stuff that you can't. They're asking certain questions that you cannot answer based upon. Okay.
Correct.
All right. So. All right. So we will wait for legal to get back to us as to any other things that have to happen.
Yes.
Okay,
Yes.
great. All right. Very good. All right. Next item on the agenda, sanitary health inspectors. So there's been a change that's occurring here as we're transitioning from a board of health to a health department.
Yes, that is my understanding. Sometime last year, the mayor has asked that the inspectors move to City Hall on the third floor under within the space of building department or under building department. However, to date, I still supervise them and they report to me. The point is that I think there is a meeting sometime soon this month to move forward to determine the fate of these inspectors. So initially, my understanding is that those inspectors would be placed under building department, but I don't know yet because I don't have the detail myself.
Okay, so is it my understanding that these are people that inspect the buildings for the livability of the building inspectors at the health department?
Well, actually, those are inspectors that have been here.
Right.
And so therefore, they are considered sanitary inspectors, health inspectors. And so therefore, we had 4 for indoor.
Yep.
That would inspect the facilities, stores, and convenience stores, and multiple dwellings. And then one with specific task of inspecting the restaurant. Sometimes he would do kitchens at some other places as well. So that made it 5, and then we have 2 that we call code enforcers. So basically, that's how it's been designed. Now, we had also 1 vacancy that has been on the chart. Last November, we had one that another inspector, or one of the sanitary inspectors, that accepted an offer with DPW. So that we're down to 3 instead of 4 sanitary inspectors. So those are the inspectors that, not having full details, that at some point might be building inspectors. So I'm limited as to the full scope of the transition.
Okay. No, it would be, it should be very clear. I mean, building inspection is very different than health inspection of a operating business, and that's I think the piece that has got to be separated out as to what is the job of the Board of Health, which is public health, handling food in a restaurant, the appropriate freezers in a restaurant, the appropriate, those really do fall under more health inspection type of issues. And then if there's a problem, to be able to trace the reason for the problem. So we've,
yes, and also the health inspectors, they also inspect the stores for tobacco permits.
Right.
And we have over 100, close to I think 112, we would say, and over 200 stores, restaurants, or any place that sells some kind of food. So yeah.
Okay. All right. So hopefully we will see a plan, but it sounds like still the inspectors are under your authority at this moment.
Yes.
And then
administratively.
And so we will we'll await the plan. But the overall plan, even for the transition to a health department, which would have obviously someone with a health background would have to be leading this, would be we've been kind of awaiting here as members of the board. Yeah, for a while. Yeah. So, and as we say, we're always happy to meet with the mayor and anyone involved in this transition to help outline the transition moving forward.
Yes.
Okay. All right. Oh, Jenny, Mr. Fisk, anything else to add?
That's a big word nowadays, transitions. There's a lot of transitions going on.
Yes, there are. There's been a lot of transitions in health that have happened with the as we sit here. Anyways, all right. Any other discussion on that point? Okay.
That's
No. Okay, great. So maybe you can update. There's multiple things here about the where we stand with what is turning into more of the epidemic than the pandemic of COVID at this point, as transitions are happening and the emergency federal emergency situation in May will be will formally end. Our statistics are what's going on in the city and how we're doing with our vaccination, et cetera. I think we can take items 4, 6, 7, and
okay.
9
Yeah.
together.
Thank you. Yeah. As of the 27, when we posted the data, we've had a little bit more, one more death. So as of today, we are at 526 deaths due to COVID. The stats that were posted this morning, we have 147 active cases and 18 new cases as of the last 24 hours. And that brings us to a total cumulative number of 34,118 cases of COVID. Now, one thing also with those numbers, that doesn't mean that 34,118 people have had COVID, because it doesn't delineate, or it doesn't separate between people who have multiple infections, who became infected multiple times. And so therefore there are repeat infections there as well. Yeah.
And we're also not counting those that home test and are positive and are not showing up in the state statistics or any of the public health statistics as well. So.
Yes, exactly. And then also this is, I know I don't think, Mr. Fisk cannot see it, but with respect to the water, wastewater sewer, this is the number that was posted as of the 29th, which was Sunday, and the result was given yesterday. So it's over 1 million copies of the sewer, of COVID in the sewer. So it's still showing a high concentration of COVID in the sewer. And I think over 80% of the sewer in Brockton is ours, is from the city.
Yeah.
It is said that about 15% comes from surrounding towns. Yes.
Okay.
Yeah.
So we've been pretty steady in the million range now for.
Yes.
Clearly down from our peak back in January of last year, but still running high compared to other regions.
Yes, and that's
Go ahead.
Yeah, and I also wanted to make a brief comparison between last month, December start, and this month already, because the last time we met, since we did not meet in January, total deaths that we have was at 509. So it's a big jump between December to the first week of February, where we have 526 deaths due to COVID. Yeah. We continue to vaccinate. The showers remain open. The nurses continue to go there every Tuesday, and booster ambulance is there also every Saturday, and their contract is extended until the end of March. Now, I think we do not know specifically how the new administration will decide, but probably a series of decisions will come down at some point that will affect public health overall and the Board of Health. So we are waiting to see those changes from Haley Driscoll administration, governor and lieutenant governor respectively. We also do COVID vaccination. We continue to do that at the Cape Verdean Association every other Thursday. We have one coming up next week with Massasoit Community College. And we also do, we continue to do some of the high rises and low rises. And we were expecting to bring in the per diem nurses so that we could strategize and try to do as many as we could, including the public schools. However, the grant that we were anticipating to tap into did not materialize. So we're simply keeping up with the number of nurses that we have. And beginning next week, they have a clinic every day for the next 2 weeks.
Can I ask, not just about the COVID clinics, but the flu clinics have started as well, or where are we with that?
We don't have much demand at the present time. We do have a number of doses left, but we have no requests right now. We have a clinic coming up also with counseling on aging. So that's one place that we probably will have some people who receive the flu clinic, the flu vaccine as well.
Right. And you mentioned at some point that you have some incentives that have been actually helpful in getting folks vaccinated, or so the public is aware that they're.
Yes, some people continue to come to the Shaw Center, because the Shaw Center it is community-wide clinic. And so it's open to the public. And so there is a source of incentive, gift cards purchased under the auspices of the state. Those cards are $75 a piece, and people can either receive the first series of vaccination or boosters, and that means monovalent or bivalent. Any dose people get, they can receive a $75 gift card, and the rest.
That's to market basket.
Some of them are market basket. Some of them are Stop and Shop.
Okay.
Some of them are Walmart also. We also have $25 gift cards. Now, the $25 gift cards, I think they don't seem to be that appealing because it's a third of what people get from the Shaw Center or the Cape Verdean Association. But the problem is because of the language, any clinic that the public cannot access, we cannot place online, then they're not really open. And so therefore, those clinics are restricted to receiving, people who go to those clinics, such as the high rises, homebound clinics. Right. So those can be those individuals can only receive a $25 gift card, which
because they're city run, not state run. Okay. So the city is providing for the city run clinics.
Well, actually, those are the city are providing it's providing those clinics, but that incentive is a CDC.
Right, is a CDC support for the city.
Right? Yes,
okay.
yes.
Yeah. So two different support mechanisms. State, if it's a state run clinic, the $75 gift card and a CDC sponsored, at least in this city, CDC sponsored.
Yes,
yes. Can provide $25. So when we continue to encourage people to get their vaccines, they clearly have changed the course of the pandemic and protect people. So we're still in a little bit, we're the post-holiday increment in this. So hopefully people will take advantage of the clinics that are available. So especially since, once the Federal Emergency Act is in place, I guess, the free vaccines may not be available at that time. Probably will not be because as of right now, the federal government has been able to place because it is a federal public health emergency. So it's going to go back to being, that people will be paying to be vaccinated. So yes. If you're thinking of getting vaccinated, please get vaccinated in the next few months, right? As soon as possible.
Yes.
In the next few months before that change happens.
Yes, we'll do. Thank you.
Okay. How about next? Any Mr. Fisk, any comments?
Nothing on that.
Okay, no. Great. Yeah, please feel free to chime in at any point. The health promotion and public health education programs, any issues or?
Yeah, we continue to work with our partners, and we have participated in many different trainings and meetings with other partners such as Brockton Neighborhood Health Center. We still have meeting with the two hospitals. Yep. At a meeting that we have right now. It doesn't happen every Monday anymore, but we meet every other week, and we also continue to reach out to the churches and the schools. So those are some of the places that we work with, and of course the other city departments to help work around health inequity so that we could address the issues. We do have health needs assessment out there, and we encourage people to really fill it out. It's online so that people can fill it, and then that will help us to understand the key needs of residents of the city of Brockton. And so hopefully we will get good feedback, good people will fill it out, and then we can have firsthand data that we could work out to really make our own internal assessment. By internal, I mean, I don't think that the Board of Health has ever been in a position where it could collect its own data to make assessment. So that would give us an opportunity to do it this time, and then we could see where the needs are. One need I know that we still have, and I try to address that as much as I can, and that's mental health, and also being part of the statewide health advisory for the state health department, the mental health department. We have meeting every month, and the issues about mental health and homelessness seem to intertwine, because many of the people who are on the street do have either some mental challenges, behavioral challenges, or have some health challenges, and so that impact how well they're able to access services or find a place to live or even hold a job, because sometimes these are difficult challenges for people to handle and function. So also on another vein, I may add that I'm also a part of the Brockton Behavioral Task Force. So we try to work together to understand where the needs are and what resources are available. And we do work to see how to best address these issues. So in the months ahead, maybe years ahead, I don't know, probably we will work now to strengthen the infrastructure of public health and mental health. And so hopefully that will lead us to a better pedestal where we could provide better support for people who need it in the city. Okay.
Can I ask, I know you mentioned the questionnaire that's out there and it's on the website, but how are you promoting that so that to try and get, more input from the city? Because that's a great effort, to try and figure out the needs, but it's also, how do we disseminate it more broadly so that you get a larger
yeah, that's a good
cohort.
question. We are looking at multiple facets by when the nurses do the clinics, and we are also having one person that will be coming as a community health worker.
Yeah.
Part-time from Brockton Neighborhood Health Center, because the state, I believe it's the state that provided the grant, but one of the stipulations is to hire community health worker full-time, and then the person will be here half the time.
Yeah.
And so that's one person I think we would also, whose help we could use to connect with people either by phone contact or by addressing the issue. And I think another way is to also see how much network, social network that we could use in order to inform people that there is a health assessment there that they could use to let us know what their needs are. So I'm open to suggestions as well to see where we could, how far we can take that.
I don't know if it, anyway, to sort of, I mean, if it's an online questionnaire that people could fill out or fill out in person, just other, the health clinics in the city, even in the hospital areas of the city where people are seeking healthcare, it would give you I think a better, trying to make people aware that it exists is the most important thing, because the more it's biased to go to the healthcare, all the healthcare facilities, but even, at the high rises, at the various community centers, using your community partners there, whether it be the church leaders and so forth, just making as many people as possible aware that it's there, because the more information on city residents that you can get, the more you'll be able to get a better, broader understanding of the and the vaccine clinics are good because that's probably a broad population, but still only the people that are coming for tend to be, health conscious and coming for the
Yes.
vaccines, right? So there's lots of ways of getting a biased sample, but approaching health clinics is another way of getting biased sample. But the community places, like the churches and the housing facilities within the city would be a nice place to just have an advertisement about it and say, if you're a member of the city of Brockton,
Yes.
hey, there's this question, we'd love to, or advertising in any way on. I mean, obviously, this is a public forum, and many people in the city know about it, but other whether community television, etc., those kind of things. Any way that we can broadly get that out to the residents of the city would be important. So,
Yeah.
and helpful to you in planning this moving forward, helping to all of us in planning the needs of the city moving forward. So
Yes. Yes.
Mr. Fisk, any issues, comment?
Yeah, I have one that's probably in regard to the homeless that you were talking about. We
Yeah.
got 2 bad days coming up. And
Yeah.
I briefly caught, I know there was a telephone call to a lot of the people, and it mentioned about, I guess, the library, and what was the other facility that they're able to go to, if need be? I don't know if you know what I'm talking about or not, but there was
Yes,
a
I know
phone
that.
conversation. At least,
Yeah, I know that the library will be open. I don't remember offhand what's the other place, but
I thought there was one other place too also, but the homeless and it's just people riding around, they see somebody out there that's, cold, get the message to them that you can go to the library. You can, if we can find out what that other facility was, but they need to do that because, I mean, it's going to be really frigid, some of the worst in years, these next 2 days. So they should get to know that and also the population out there to try to help people to, to get them to those facilities too.
yes, I do know that the mayor's office, BIMA, and the police departments are actively looking into it. So I can verify to see what the other place is, and I could send that over to you.
Maybe even have it on our website for the weekend.
Yeah.
Something
So other
just
people know about
there
it,
so
yeah.
that other people, that people are aware of it. I mean, the more, and it's good to hear that the police are involved because they'll be patrolling the streets and seeing people who may be in need. But for residents that see other people in need, it'd be good to know that the libraries and whatever other facilities within the city will be open for folks to go to.
Yes, absolutely.
And also, the other safety net of knowing that more publicly is that if for some reason there's issues with power at a house or you lose your heating at a home, people are going to be looking to find the place that they can go for shelter. So it's good to know what's open in the city for shelters and make that publicly available. So
yeah,
okay,
correct.
So next item on the agenda is, I guess, the just miscellaneous things that you wanted to bring to our attention. So one being that we can extend the remote meetings at least until March at this point under the rules, and we'll wait to see what the new administration puts in place. But for now, we can still continue to meet virtually, but at some point we will turn back into a in-person public meeting.
Yeah, I suspect that may happen. So we'll just wait for the word to be disseminated either directly to the state media and maybe more directly through the legal department to make sure that everyone is aware of it. So yeah. And once I know, then I will inform the board of the well, actually, we have another month, at least another. We have one more meeting.
Hold virtually. After that, it will be in person. And then I guess the other issue is about RSV in the city. That they're
yeah, the numbers, they seem to taper off because we don't hear that, and the statistics do not increase as they were increasing in December and January. So
so we're starting to come down a little bit.
I think somehow they seem to be all triple demics
Yes.
tend to be going
In the
down.
downward,
Yeah.
Yeah, well, I think that there was the post-holiday Thanksgiving holidays and people gathering that caused that the surge that we had. I was also previously meant to ask you, you say you meet with the hospitals, and the hospitals here are capacity-wise are doing all right, or so I
Yeah,
know there's staffing issues in many healthcare facilities around the country, and just wondering how the facilities within the city are holding up.
This is the last report that the state issued, which reflected the hospitals, and Dr. Herman, also Richard Herman, who is the medical advisor to the or
Mayor,
consultant to the mayor. He gets update regularly from the hospitals, but this is the one that we had specifically with respect to COVID. So as of the 27th, basically they had about 10.8% positive rate. So that is slightly high because the protocol or the standard is to have it below 10%.
Yeah.
But given where it was, that's a big jump. And for the hospital themselves, in terms of patient, they were at 8.6% capacity with respect to COVID patients.
Yeah.
So
But the regular capacity within the hospital, they still have beds open, and not at a level where there's diversion, and which was happening, I think, in December, and particularly in December after Thanksgiving, that many of the hospitals, there were no beds in many facilities in diversion, but it sounds like that we're not in that situation at the moment. COVID is still high, but coming down, and beds are available within the facilities. Okay, great. All right. And then lastly, your medical advisory committee that you're on. So,
yeah, the MASET. We do see a series of TB cases in the city,
right.
And so all of our 3 nurses are regularly involved in DOT.
Yeah.
Because of some people who have it, and they have to be observed.
Yeah.
In order to make sure that they adhering to the regiment.
Right.
We do have one case that is a little bit reluctant and non-compliant, but I think the state is handling it so that we may be able to find how to move forward to assist. Okay. The MASET, the Medical Advisory Committee to Eliminate Tuberculosis, they meet regularly every second Thursday of the second Wednesday of the month, and so excuse me, they look at the whole aspect of where people access services, people who have a positive TB test, and I think one hospital that is connected to the DPH to provide the service was about to shut down because this is an area where money doesn't really, it's not money making part of the health. So one person was retiring, one physician that has experience in seeing TB patients, but another physician step up and volunteer his services. So we continue to provide that help that help that we provide with the at the committee level to let them know where the needs are and how they impact our city, and what we can do together in order to mitigate those cases. And I'm glad that we also have nurses following those cases as well, because that gives me an opportunity to know that we are dealing with it here. And so being part of the statewide committee, advisory committee for the medical team to eliminate TB. So I think it's a point for us at the city of Brockton where we not only deal with the cases at the local level, but also we are able to also highlight the need at the state level.
Yeah.
Yes.
On average, how many patients, just sorry, and I'm only, it can surely be an estimate, how many patients do the nurses usually wind up having to follow in
Right now, we have more than I've ever seen. We're close to 10.
wow.
Yeah.
Yeah. Okay. But that's a little higher than
Yeah, it's usually 3, 4.
Yeah.
Yeah. It's
So-
I mean, since I've been here, I've been here little under 3 years.
Yeah.
But this is the largest number I have seen.
Mhm. And is this statewide or is it just within the city?
Yes.
It's
Yes.
statewide. Okay.
Yes, I did ask the question if that had to do with refugee, but didn't have the data to justify that. I was thinking that maybe with the new immigrants, perhaps that might be one reason that the cases increase, but they could not.
Well, there also can be outbreaks in the shelters. I mean, this is the vulnerable areas, right?
Correct.
Where the outbreaks can happen. So, and just for Louis and I don't know if Andrea's on, that when we say DOT, that's the those
Directed
observed therapy. So with TB, it's you start a treatment regimen, but it is critically important that you take the dose every day. Otherwise, the TB can become resistant, and so it becomes far more challenging. So it's very important to stay on therapy, and it's a very proven method worldwide that this observed therapy that the public health nurses have to do this and track this. Yeah, and we've had various outbreaks in the shelters over time that have caused concern. So and it sounds like we have a little bit of an uptick right now. So we just have to keep an eye on this as we move forward. So. All right. Any other things that need to be brought to our attention?
I think that's about all I have for the agenda today.
Okay. Wonderful.
Um,
So maybe our Luis or Andrea, if you're on, any questions for us? I know you're doing this as part of your the educational requirements. So any questions or comments from your end?
yeah, Andrea, Terry, Louis, Itasi, do you have any word you would like to add? On the meeting, we have Dr. Brophy, who is the chairperson of the Board of Health, and Mr. Fisk, and myself. We're missing just one member today. Do you have anything that you would like to share with us? You're on mute. If you want to say anything, you can unmute yourself.
To add. Just would like to say thank you, but really, I don't have anything to add.
Okay.
All right.
Okay.
I've got one little item that I'd like to bring up.
Sure. Mr.
Yeah, it's just, I've been getting a lot of questions. A lot of people have asked. I think I know the answer, but I just wanted to double check since we do the tobacco license and everything, the marijuana shops that are all over the place. That's by the state, correct?
Yes,
And-
unfortunately, that's above our jurisdictions.
That's what I thought, but I just wanted to double check because that's what but they just seem to be sprouting up all over the place. And, tobacco, marijuana, I don't know, but it just seems like we have no say about it. And, when you can see one shop up the street from another, it's getting like a McDonald's, you don't have to go too far.
Not at all.
Not at all. No. Yeah, all the permitting, all the regulations, all the inspections are in the hands of the state.
That's what I thought. Yeah. So I just thought I'd bring that up just because I do get a lot of questions about that.
Okay. All right.
Yeah.
And I think, I believe that the feds still have their say. I don't know how much weight it carries, but
And we did mention about I don't know, we brought it up, I think, last meeting about these banquet halls. Has there been more about that anymore as far as can they have their own food, make their own food, or people bring the food in? Alcohol, have we gotten much into that with these banquet halls? There's a new one that's on the main street. I don't even know if it's open.
Yeah, no, we take them, oh, sorry. We take them case by case because as we mentioned at that meeting that
Mhm.
they will have different needs depending who's meeting there and if they hiring caterers to bring the food or if the individual people doing the festivity bring the food. So it's on a case by case that we move forward. Right now, we don't have any since the meeting. We don't really have one that applied for permit because once they have a kitchen, then we have to inspect it and then issue a permit.
So as a hall, then there's no permit for the hall. I mean,
Just
it's
a
not
hall,
like,
yeah, just a hall is it doesn't warrant a letter or a permit from the Board of Health per se, because it's an empty hall for social activities, social gathering.
Mhm.
And the one thing is that they can't be smoking, there's no smoking. If
Right,
it's a
yeah,
hall,
because it's not
there's
like
no
a club or
smoking and
anything.
there's no alcohol. But if it's one of these clubs, you have to be a member. In
Yes.
order, yeah,
Yeah.
so there's you can't just rent a hall and use the even though smoking may be allowed in a membership club,
Yeah.
you have to be a member in order to be able
Yeah,
to.
there's always a key or some type of
Right,
combination. to
exactly,
the-
exactly,
Something like that. It's people from the street just can't, walk in. But
exactly.
I receive a lot of comment, questions about that type of thing. So,
Yeah, okay.
Yeah.
Okay, great. Any other issues from anyone? With
none
that,
here.
okay, so so the next meeting of the Board of Health would be March 2nd of 2023. Probably still allowed to be virtual. At that point, we will be, but that may be our last virtual meeting. So, and with that, I'll accept a motion to adjourn.
Yeah, motion to adjourn.
All right, all in favor? Aye.
Aye.
Okay, so we'll meet again on March 2nd.
Okay.